Hello and welcome everyone to another edition in the Asia Society's global online platform of programs that we began a couple of months ago now in the initial days of the COVID-19 outbreak. Um, I'm Tom Nagorski. I'm Executive Vice President of the Asia Society in New York City. And we come today with a subject and an issue that has actually been part of many conversations that we have had about the outbreak and about its implications around the world, but we've never addressed an entire hour to it. And that is the role that technology can play either in advance of an outbreak, when an outbreak comes, or as this country and other countries around the world are now contemplating the moment when one starts to consider a return to something approaching normalcy. But along with discussions about new apps, new technologies, new ways to gather data that may help from a public health perspective, come a lot of questions about some potential for misuse, issues pertaining to surveillance and privacy. And to look at those questions today, we're delighted to have two terrific guests from two corners of the world today. In New Delhi, Nikhil Pahwa, founder of MediaNama, which works to build, quote, an open, fair, and competitive digital ecosystem. Nikhil also led the Save the Internet campaign in India, a huge and hugely ambitious effort to bring net neutrality regulations to his country. Proud to say also that Nikhil is an alumnus of the Asia Society's Asia 21 Young Leaders Network. Nikhil, great to have you with us. And joining from Washington, D.C., great also to have Jennifer Daskal, Professor and Faculty Director of the Technology Law and Security Program at American University Washington College of Law. Her expertise is in privacy, cyber, national security, criminal, and constitutional law. That's a lot to be expert in. Jennifer Daskal also has held positions at Human Rights Watch, the Open Society Institute, and the Georgetown Law Center. So as I said, very qualified, terrific guests to have with us, and welcome to the Asia Society platform to you both. To get started, there is, as I hinted just a moment ago, this rush now to find some technologies, new apps, and so forth. We'll hear, I think, in a moment what India is up to and very recently come up with in this regard to help with contact tracing, a term that we've all become familiar with, and other things. It has been described in one piece recently as a mad rush for these kinds of technologies. But I think it's fair to say it's understandable that such a rush is underway. It's almost probably as much of a rush as there is to find a vaccine. And it's understandable because when you consider that without some greater base of knowledge, some more data about cases and who's got the antibodies and who's really distancing and who isn't, so much harm can come. But I'm curious to know, just to start us here, your response, your fundamental concerns about that rush, about the technologies being used in this fashion. Jennifer Daskal, why don't we start with you?
Great, thank you. And thank you for inviting me to join, and to all of the guests who are online. It's a real pleasure to be here. So I think before we get to the concerns, I think it's first worth kind of breaking down what the different kinds of approaches are, because the different approaches raise different issues and different concerns and different sets of benefits. So there's some set of kind of surveillance that's using aggregated data that is doing things like mapping out how well people are doing with social distancing by looking at clusters of how much people are clustered together, or how far apart they're located. And there's tracking that's using cell phone data and other geolocation data in an aggregated, anonymized way that kind of provides information about population level trends. And this is information that health officials say is quite useful. Way less concerns about that, assuming, of course, that the data is appropriately anonymized, and we can get into a discussion about that. Then we start moving to individualized tracing, and that's when the contact tracing apps come in. And they are used as part of a bigger, broader strategy. So they're not, I think we need to say from the beginning that contact tracing apps cannot be a panacea in and of themselves. The medical experts talk about test, trace, and isolate. So step one, you need enough tests. And then there needs to be an action at the end of somebody being alerted that they've been in contact. So this is the idea of contact tracing is not something that's unique to digital tools. It's something that humans have been doing for a long time. And we did this, many did this when people first, before these digital tools were first developed, someone comes in, they test positive, health officials ask them questions about who they've been in contact with and close contact with, and the health officials will then reach out to those individuals and say, hey, you've potentially been exposed, you need to ideally go get tested, and that's why we need the test, or take some steps to protect yourself and others. The digital tools are coming in because people's memories are faulty. It's also hard to have enough people to do all of the contact tracing that's needed. And so the digital tools can augment that if they work. And then that comes into a really big set of questions about how they might work and how they're designed. And I'll be brief and then we can come back to this. But I think at step number one, there's a big distinction between tools that involve government collection of all the data and kind of centralized databases that the government then has access to information either about the location of many, many individuals or their association because they're tracking proximity data, or the kinds of apps that are being designed and rolled out, for example, the system being designed by Apple and Google that involves decentralized data collection where there is no centralized database and all the relevant data is held on somebody's phone. The system, there's also a big difference between mandated systems and opt-in systems. The system that have been talked about, at least in the United States, at least government-wide systems have all been talked about as opt-in, which from my perspective makes sense. That said, most experts say that unless you get close to around 60% or more of uptake of these kinds of apps, they're not going to be that useful. And even in Singapore, where these apps have been touted and discussed quite extensively, there was only about a 20% uptick in these apps and in the use of these apps. So real questions about whether they can actually serve adequately the purposes that they're meant to serve unless A, there's enough testing, and B, there's enough widespread use and then appropriate action after there's an alert to be useful. And then finally, there's a question about how good is the technology. So most of the apps are now moving to use of Bluetooth technology, which can map proximity as opposed to location. That's beneficial for a number of reasons, including the fact that proximity data is generally deemed less sensitive than location data. But Bluetooth can read signals through walls. It doesn't account for weather. And so you can have people alerting when they're sitting in a traffic jam with their windows rolled up next to each other for an extended period of time. So there's questions about accuracy as well and about false positives and false negatives. Putting even before we even get to the kind of security and privacy questions. But I'll stop there and we can come back to all of that.
Well, you put a lot on the table and very succinctly, so I appreciate it. I want to just have one follow-up and then we'll go to Nikhil, who of course has a very specific, almost case study of one of the things you're talking about in India. But one follow-up for you, Jennifer, and there probably isn't a brief answer to this, but you say, problems arise when the data comes in the hands of a government, right? Which theoretically totally understand. On the other hand, if it's not in the hands of some central authority, and that assumes then that central authority, the government, is also helping inform public health policy and public health decisions, then it sort of is stripped of some of its use, isn't it?
Well, not necessarily. And so when I talk about data in the hands of government, there's different ways to design these systems. So one involves government collect all the location data, all the proximity data, and then they hold it in some sort of centralized database, and they then use that information to help facilitate doing the contact tracing. There's another way to do this, which is what a range of universities are developing and nonprofits, and also, as I said, Apple and Google, this is their system as well, is a decentralized system so that the relevant information about who somebody's been associated with, who somebody's been near enough to get the Bluetooth alert, is held on individual users' devices. The people who have opted in get basically codes that identify what other phones they've been in contact with. And then the alert gets sent through this decentralized system without any sort of massive government database being collected. Now, of course, public health officials can and will know if somebody's tested positive to activate this alert system, and can and in some cases should learn who the other people are who that individual's been in contact with. But that's very different than having a centralized database of vast quantities of location or associations of all of one's citizens, which this raises concerns about how that kind of data might be used for other purposes as well.
Got it. So let's go to New Delhi now, where I used to be a journalist, so forgive the term breaking news, but Nikhil, you were telling us a moment ago about what qualifies as somewhat breaking news over the weekend in terms of government policy there. So here we're talking about in the United States and other parts of the world, a rush to find some technologies. Why don't you give us an explanation of what the Indian government has announced, because it goes to an awful lot of what Jennifer Daskal was just raising.
Sure, Tom. So, Tom, India went into a lockdown about 5 weeks ago, and that lockdown was opened somewhat just the day before yesterday. But one of the conditions that was imposed for easing up a complete shutdown across the country was that everyone has to have a contact tracing app developed by a bunch of private volunteers with the Indian government called Arogya Setu, which means bridge to health in Hindi. So this is, they've done a decent job with the privacy policy for Arogya Setu, in the sense that data that's shared with the government is anonymized, but it's linked to a unique ID, which is linked to an individual's personal information. And depending on your situation, the data is deleted from the device every 30 days and from the government server every 45 days. But it's been mandated for everyone. So India's got about approximately 500 million smartphones, or 400 million smartphones, about 500 million users online, out of a population of 1.3 billion. So making it mandatory means that you're going to see about 400 or 300 million people start using it eventually. And the fear is largely one of scope creep. Firstly, as Jennifer mentioned, the efficacy of contact tracing is highly questionable. There is no paper in the public domain that explains how this is actually going to help. But within the app itself, we are seeing, if you download the app and switch it on, you first ask a few questions about your health status, and then your whether whether you have a problem or not, or whether you are infected or not. That indication is given through an orange, red, or green code. And it's all based on self-certification. So the efficacy of that information or the usefulness of that information is not very clear. Secondly, even as Jennifer mentioned about contact tracing using Bluetooth, who you've been in contact with is only relevant when there isn't community scale infection in the country. And I think India is adding about over 1,000 cases a day. It's not as bad as maybe New York, but I'm not sure how this is really going to help people determine whether they need to get themselves tested or not. At a broader level, you're also getting information about how many people have installed the app in an area. But the real worry is that this app, because it has such a large install base, is being used as a means of adding more and more services to it. So, for example, there is an e-pass functionality which is being introduced. It's shown on the app. It's not gone live yet, which you can show to, let's say, a checkpoint. Whether you are permitted to go into certain areas or not, or whether you're permitted to go to work or cross state borders or not, and that requires a certain level of verification. Now, how that data is linked with your contact data is not very clear. Contact tracing by itself is a privacy violation. Let's be very, very clear about that. Any app that tracks your location all the time, and in India, the app tracks your location, but also one that tracks who you have been in proximity with on a regular basis, violates your privacy. But I do understand that we are in exceptional times, and these are exceptional circumstances. So the question really is, how much of your privacy are you okay with being violated to deal with this current situation? And in that context, one of my primary concerns with apps and technology such as this is that they don't come with a sunset clause. They don't come with a proportionality test that regularly checks whether is it time to destroy this app or dismantle this app and destroy all the data that's been collected. Is it a committee or a government department that's going to sit on it and take a decision about whether things are fine enough now or not? So, we really need some kind of oversight, but there is no clarity, at least in India, in terms of what the sunset date is and what kind of oversight is in place.
So this is a question actually for both of you, because I think it's fair to let Jennifer weigh in on her thoughts about this, staying with India for a moment on what they've just done. But I'll play devil's advocate, but it's probably devil's advocate from a position of ignorance here, or at least relative ignorance for you, Nikhil, which is, I can only imagine that the public health officials in India, with the population that they have, with public health issues that India has even in normal times, that the challenge is enormous in a situation like this. And honestly, when you describe the features of that app, the Bridge to Health app, 500 million smartphones, so potentially hundreds of millions of people downloading, and the fact that it gets, I think you said that information gets deleted in 30-day increments. I guess what I would ask is, in the always difficult measurement of public health versus the privacy circumstances, is it not imperative for the Indian government and public health officials in particular, to find some way to quickly amass information about outbreaks, about who's where, and this sort of thing, accepting the points you have made about the concerns?
So, Tom, I think the challenge really is that does this solve the problem? And I think the problem with many countries in the world is that there is a sense of tech solutionism that is really popular right now. Governments don't necessarily understand technology. They don't necessarily go into debates or discussions about how a particular technology is useful, whether it is useful or not. And I'd rather that government focus their energy on testing than focus their energy on an app that has questionable usefulness. But let's be fair, governments have a difficult job to do right now. They don't necessarily, they have to act quickly. They have to, and that's why I think one is very thankful that the Indian government locked down the country as early as it did, because I think that's probably prevented, a scaling up of cases in India. But now we do also realize that from an economic perspective, you can't shut the economy down for that long. And India is not as rich a country as many in Europe or the US or even China. So we have to try and bring back some sense of normalcy and some sense of going back to work. And this app is being seen as a mechanism to allow people to go back to work. So if you are green, or if you're in a green zone, so to speak, then you can get back to work. I'm in a city that's in a red zone, which is New Delhi, and even there are neighborhoods that are marked as containment zones and red and orange zones. So there's a different set of things that you're allowed to do depending on the zone you're in, but also depending on what your status on the app is.
Right.
The danger that we face going forward is that this app effectively becomes a means of having the right to rights. If you don't have this app, you don't have the right to rights. And I think we have to be very careful and conscious about a sense of permanence that might come to an app like this, which is what we're seeing in China with its health code, for example. And let's also not forget China's, social credit system. And when these things start getting linked together, I think you have to worry about whether they are in consonance with fundamental rights, with human rights or not.
So, Jennifer, I'm curious to know your thoughts about this. Speaking from another, to use Nikhil's term, another red zone. I mean, we don't have the app here, but I don't need the app to know that Brooklyn and the rest of New York are in a zone like that. I think it's pretty safe to say a lot of Americans, certainly a lot of people here, and we are, I'm in, one of the most liberal-minded parts of the United States. I think right now would take the trade-off of a little bit more infringement on privacy to know that they could go here, they could go here, a business here would be okay, someplace else would not be. We're seeing a huge political divide all over America right now that is not driven by data at all. It's just driven by the pain that some people are suffering, particularly economically now. But when you hear the description of the Indian measures before we go to other parts of the world, what are your thoughts?
Well, so just to start where you started, I mean, I think that's right. I think that right now in the United States, or at least large swaths of the United States where I am too, people are totally locked down, and that's a pretty big infringement on civil liberties. And so there's really important questions about what are the safe and effective ways to allow us to re-engage and begin to do so in the safest way possible. And to the extent technology can help, I think we should absolutely pursue the use of technology to help us do that. I think from my perspective, there's a few issues to consider. One is that technology is not, as I said before, it's not the panacea, it's not the knight in shining armor. And so I think, at least with respect to contact tracing apps, sometimes they're portrayed, or it appears as if they're going to be the solution. And they can't be the solution without a much more holistic solution that in particular involves testing, but also ensures that the apps are reliable and that people follow them and that there's sufficient use. That the sufficient use problem seems to have been dealt with in India by the fact that they're being mandated. But if that happens, then there's a whole set of other questions that I think also need to be addressed about what happens to that data, who has access to the data, how do you ensure that, as was said, that if this is an emergency system for an emergency time period, that the apps, that the requirements that people download these apps don't continue after the emergency exists, and that the data is in fact deleted after the 30 days that was mentioned, and that it doesn't become part of a new normal, a new kind of surveillance state. And so I think it's fair to look to technology to help us, but we also need to ask really hard questions about, is the technology actually serving the purpose for which it's claimed? What else is needed? And how do we ensure that any emergency measures are coupled with sunsets that are actually enforced and meaningful, and limitations on how this data is used? And in particular, I think in the United States, that's incredibly important. I say this often, that good health and good privacy go hand in hand, because particularly if we're in a world where we're talking about opt-in apps, which I hope we primarily are, we need people to trust I mean, we need people to trust them to use them. And more importantly, even if we're not talking about that, we need people to trust their public health authorities. We need people to go and get tested and do all the things that will help us keep us safe in important ways. And to the extent that people fear going to get tests because they fear that it's going to lead to excessive monitoring and monitoring in ways that are used beyond just the public health needs, that I think can actually be to our health detriment. So yes, we need to do everything possible. Yes, technology can help, but yes, we need to be very careful and ask hard questions before we kind of assume it's the answer.
So thanks for that. It's a good moment to remind folks, although looking at my question file here, I see some people are well aware of how to do it, but if you're watching, whether on YouTube or Facebook, our Asia Society program this morning, you can use the comment functions to send questions for Jennifer Daskal or Nick Hopawa. Your point about trust, Jennifer, is a good jumping off point to another part of Asia that I want to focus on. You also use the term gold standard, or no, you didn't use, knight in shining armor is the phrase, I think, and that contact tracing shouldn't be seen as such. I want to go for a moment to South Korea. First of all, on the trust point, we did a couple of looks around for polling on this subject. 71% in a recent poll here in the United States said they would support the sharing of more personal data to improve understanding of the public health situation, et cetera. In South Korea, that figure was 89%. And we did a program 3 weeks ago now, I think, on how South Korea had, quote, flattened the curve, because they have become kind of a little bit of a poster child for the phrase you use, test, trace, and isolate. On that program, one of our guests was actually an American professor, John Delury, who's has lived in South Korea for a long time. And he was very torn because he's a California native, believes firmly, I mean, as much as anyone, in the values and the privacy rights that we hold dear in this country. But he also had watched sort of painfully while relatives were struggling with what was happening in the United States. And here's what he wrote. I told him we were having this conversation, and he wrote me this note, which is sort of an observation and a question in one. In South Korea, the key thing is that information relevant to public health was put in the hands of the public via alerts and apps of vectors in your neighborhood. It's all in the public realm. It's all transparent. By the way, this was part of a temporary emergency protocol that they had prepared for because they dealt with the MERS, Middle East Respiratory Syndrome outbreak many years ago. So they were prepared. The public is hyper-informed. And South Korea not only flattened the curve, they did it without ever imposing any kind of lockdown. Now, it's maybe an unfair comparison to the United States, where we have done poorly with testing, as you've pointed out. But surely that's an example of contact tracing where it's very clear, right, that the benefit was enormous. I'll come back to Jennifer and then maybe to Nikhil.
So, I mean, I think, again, I think you can't isolate the tracking and the testing. I think they have to, the idea that the tracking could be successful without the testing, I think,
sure,
hard to believe. I mean, it's just hard to think that could be possible. I mean, I think that, first of all, I think one of the issues in South Korea, so as you pointed out, that everything was transparent. What South Korea did was that they combined a lot of information from facial recognition technology, credit card records, cell phone data to track movements of people back in time for 14 days who have been identified, who have tested positive as ill. And they publicly posted all of that information without identifying anybody by name, but in ways that anybody who knew somebody could pretty easily, oftentimes, figure out who particular individuals were. And in addition to the benefits, I think we have to kind of disaggregate what the causal factors are. But it also led to a number of instances in which people were subject to a fair amount of vitriol and abuse and shaming because you're basically publicly, even though individuals weren't named, there was kind of a public sharing of people's movements in time who were identified as ill, and that created some issues as well. So I think, I mean, the other piece of this that I think is also critical is that is understanding when contact tracing is useful. So it could be quite useful at the beginning of an outbreak because at that point there's not a lot of people who are ill, and therefore it can be used to ensure that people take the necessary steps before we get down to the lockdown period. At this particular point, when so many of us are locked down anyway, it's not going to do a whole lot because we're not being asked to do anything different. It could again become quite useful if in fact we are reintegrating and the disease takes the kind of path that's been predicted, in which there's waves and troughs and peaks and troughs, and then at that point it could be quite useful again to use contact tracing as a means of identifying where people might have been exposed, and then ideally having the kinds of testing that's needed to enforce the steps that are needed to help keep other people safe as well.
Nikhil, why don't we pick up on the tail end of what Jennifer just said then? What would be of value? Put yourself in our shoes here in the United States, right? As I mentioned, there are these debates, and they're rather nasty in some places about open, don't open, we're safe, we're not safe. What role could technology play in a constructive way, do you think, to help communities, cities, rural areas, but mostly just health policymakers to make smarter, better, safer decisions?
So, Tom, one simple solution could be that you designate different parts of cities and areas at different types of zones, and allow people to understand what kind of a zone that they're entering, and understand how susceptible they might be on their own health conditions through a survey. But that data doesn't necessarily need to go to the government. Look, the problem with this particular disease is that people remain asymptomatic for a very long time, which is where the propensity for someone to spread the disease while being asymptomatic is extremely high. But we've also seen significant risks for individual liberty come through that because, so for example, when India initially locked down, there were lists of people who were in quarantine because they returned from outside the country that was circulating, published by government departments, circulating on WhatsApp and other messaging apps. There were houses which were marked with stickers that indicated that people in that house were in forced quarantine, and this was before the lockdown. There have been instances where people have been ostracized from particular neighborhoods, from societies. There were reports of doctors being asked to vacate their homes if they were on rent, because people didn't want them living there because they might have been more susceptible. So look, every society is going to respond differently based on its own behavioral patterns, and India is not necessarily one that tends to be very nice to people that might be a risk in that sense. So, and that's exactly what we've heard of from South Korea and China as well. So in those circumstances, again, I would go back to the point about what do you do to protect the rights of those individuals, which is not expose them to the public. So we've seen more of a negative impact of technology rather than the positive ones, because the efficacy of contact tracing is still questionable. But we've also seen drones in use. Drones are being flown around with speakers and loudspeakers asking people not to congregate in particular areas. That video footage has been published online where people's faces are easily identifiable. Some of those things are not necessarily needed to be done. You don't need to publish that information, but you can use drones to impose that lockdown, for example. Yeah. And that helps prevent risks. I would say that we shouldn't approach these issues from a technological perspective. We need to approach these issues from an epidemic perspective. And again, test and isolate is the important part. Trace isn't necessarily that important. Again, you also have to have the capacity to do tests, and I think in India we're testing far less than we ought to be. So let's see how this goes, but I think we will see more and more uses of technology. Whether that yields any positive results or not is anybody's guess.
Yeah. I should say, by the way, there's a different kind. You've got drone footage here in New York where we had a very warm spring weekend. There were plenty of people who got very annoyed with those who were congregating or those who were not wearing a mask. And what they do is they take their phones, they take a picture of those people who in their view are misbehaving and then put it all over social media. So that's, I guess, that's the power and the right of individuals to do that. We're getting good questions online here, so I'm going to just toss a couple of them your way. From YouTube, can there be an international guideline from the WHO or other UN agency to mandate that governments strictly use data for a specific period, going to a point you both have made, only for the purpose of COVID-related contact tracing? Would that be a good thing? Would it be in any way enforceable? Nikhil, you want to take a stab at that?
So Tom, we had a discussion a couple of days ago on norms that we would like to see. And let me read out some of the norms that we put together from a community of folks that are interested in technology and policy. First one is when you're collecting data, anonymize early. Do data minimization. Only collect the data that you really need to collect. So for example, tracking location information in a contact tracing app isn't necessary. Take a proportionality approach. So therefore, if you're deploying technology to surveil people, decide what you need to do when, how, and for how long. And that kind of analysis is necessary before deploying technology. Do purpose limitation. So limit it only for the purpose of tracing COVID positive folks or people who might get it. And that data should only be utilized for the purpose of fighting this epidemic. Have principles on non-discrimination in place. Have a limitation on sharing that data, because if the government has collected data, it shouldn't be shared with other departments and other people, especially private parties. I think some of that's happened in China from what I understand. Have a separate law or a temporary legislation in place for this temporary period of time, which is, for example, Singapore has a law that essentially limits, that has a specific set of norms that have been put into place for fighting the epidemic. Possibly have a temporary regulatory body that looks into privacy concerns of all the technology that's been deployed. And most importantly, and a point I've been making quite often, is have a sunset date in place. That date can be reviewed on a regular basis, but at least when you're deploying such technology, ensure that there is a sunset date in place. And these things can be incorporated into international recommendations. The EU has a great set of recommendations that it's made to its own member states. Some of these points are from that recommendation as well. I think we need to have international norms in place.
So from international norms to a question about U.S. legislation. And I was going to ask you, Jennifer, whether there's any work in progress. The U.S. Congress sometimes gets blamed, I don't know whether fairly or unfairly, for just not really being nearly as savvy enough about technology as it should be. We have a question. It's actually from June Park, who is another alumna of the Asia 21 Young Leaders Network. And she's originally from South Korea. She asks, is there a bill being drafted in the U.S. Congress akin to South Korea's Infectious Diseases Prevention and Control Act, on which the conditional personal data use is based? I mean, I guess more broadly, is there any legislation on this front being considered? Is Congress active in this regard?
So Congress did, as part of one of its spending bills in response to the coronavirus, it provided hundreds of millions of dollars to the CDC to do basically biosurveillance. But my understanding of that money is that it's been used to do the kind of aggregate data analysis that I talked about at the beginning. So it's being used to map out trends and use information to figure out health patterns and possibly doing some work with respect to social distancing as well, but not to do any kind of individualized tracking. I am not aware of any legislative proposal at the moment to do any of the kind of surveillance that was done in South Korea, or it has been enacted in other places as well. The extent that in the United States we're talking about contact tracing apps, my understanding both at the federal level and at the state level is that we are talking about them as opt-in. There is, and there are efforts by employers to mandate that their employees adopt some form of apps, or there's various talks of maybe even having Bluetooth implanted IDs and badges that would allow employers to do contact tracing for their employees. But that is a separate issue than the government mandating it. And here we're talking about private sector employees, not public sector employers.
Mm-hmm. Now, there's a question about the Google-Apple partnership, but it implies that we know much about it. Jennifer, can I put you on the spot? I think you've had some good things to say about what they are up to in this regard, and Google so often comes in for criticism about these kinds of privacy issues. But can you just explain for our audience what the partnership is and how it's relevant to this discussion?
Yeah, so again, so there's background questions about whether or not this will be effective, and so I think that's a really important kind of overarching set of questions. But in terms of the design of the contact tracing apps, the system that Google and Apple are working on, I think it's actually in a lot of ways quite encouraging, and it incorporates principles that privacy experts talk about all the time, called privacy by design, in the sense that, as we talked about, the data is decentralized, it's held on its phone, it's not, Google and Apple don't hold on to the data, it's all held on individual users' phones. They've been quite transparent in terms of publishing their technical specifications so that other experts can look at them and provide comment. The codes, the Bluetooth codes, the reading are constantly shifting to minimize the risk of hackers and others getting access to the system. Now, any such system is never going to be security free. It's never going to be secure proof. There's always going to be risks involved, but my understanding of what they're doing is pretty encouraging if you think it will actually work. And I've already raised a number of questions about that. They are talking about ultimately embedding the option to have basically the system in place that they will push out through their operating systems. But in order to basically activate it, individuals will need to opt in. And my understanding is that they opt in generally by downloading particular apps and then activating those apps on top of the operating system. And one of the things that's interesting about this is it's interoperable between Android phones and iPhones, so that the Bluetooth signals that are doing the tracking can read whether you're on an Android phone or an iPhone. So I think, and my understanding is they've worked very closely with technologists at MIT and elsewhere, I believe. And in terms of design, I think it's an encouraging use of how technology can be designed in ways that are attempting to achieve a goal in a relatively privacy protective way. Again, not to beat the record, but there's questions about how effective it will be.
Well, and actually, you've sort of answered the rest of the viewer's question, which was just in the U.S. regarding the Google-Apple partnership. Are apps even enough? A recent study from Harvard Center for Ethics showed a comprehensive contact tracing program would entail performing 2.5 million tests a day, but nationwide testing capacity has plateaued at about 145,000. So I think that's more just to button something you've both said. Now, there's an interesting question from South Korea, and it's sort of another U.S. versus South Korea question. Nikhil, maybe we'll let you have a crack at this one. It asks about the irony of Americans' insistence on data privacy. Americans pretty much know that the tech companies already own and resell more data about us than we know ourselves. So that's, I guess, also an observation, but in there is the question, right, that, what are we talking about here? The viewer is correct that Facebook and so many other companies have so much on us already. I don't know if it's true that they have more data about us than we know about ourselves, but given that we've given that much away already, that if we were to give away some more of this data to the government, again, in the name of improving the public health here, what's wrong with that?
Well, Tom, I think that's where the idea of power asymmetry comes in.
I'm sorry, what symmetry?
The issue of power asymmetry. Governments have disproportionately more power over us as opposed to a company that we might be giving our data to. So we might actually, what a company can at best make money off us, or maybe topple our governments if they feel less benevolent than they are. But they really can't put us in jail in that sense. And I think it's one thing to look at it from a U.S. perspective, but where in countries where civil liberties aren't as strong or as respected as the United States, you do find a situation where this data in the hands of governments can be used for massive abuses of power. And so the risks are greater perhaps for the rest of the world. That I'm not letting companies off the hook over there. They do need to be held responsible for the amount of data that they collect on us, quite often without our knowledge. And that's where you're seeing more and more privacy laws getting created and imposed across the world. The EU has taken a lead on that. And I think we need to see more iterations and more improvements with time. There is a global market failure in privacy, but I think it's important for us to believe that we haven't lost it yet, that we still have to fight back and for that space, and we still have to get whatever of our human rights to privacy as we can for the future back. For me, the most important tool there is information about what data has been collected by you should be available to you, and the ability to delete that data should also be available to you. Right. When you do that, you rob companies of that power, and I think to some extent that must also be available with respect to governments. So transparency, accountability, and the ability to delete data. Data should be treated like a nuclear waste. We need a move towards data disarmament globally, because the data has been weaponized against us as individuals.
Very interesting point. Data as nuclear waste. Another question, and we're winding down here, I'm mindful of the time. Another question I think I'll just read is, it's really more of an observation. What about manual contact tracing? I think, Jennifer, you referred to this earlier. In Massachusetts, a manual contact tracing program, which is basically the old-fashioned way, one-on-one telephone interviews, is underway. It's labor intensive and prone to human error, but there is at least the element of human trust. I want to, maybe this is, can be our last point to touch on here. And forgive me, it's a little New York centric, but it does have, I think, global implications. I cannot help, as we have this conversation, but cast my mind back to the September 11th, 2001 attacks. And the conversations, and of course, a completely different set of circumstances, but of course, trauma inflicted in particular on the cities of New York and Washington, and a conversation that was had in the immediate aftermath that I think, to summarize and simplify terribly, was along the lines of, if we can be assured as New Yorkers, as Americans, and to some extent others around the world, that we will be safe and we will not be attacked again. We will make some trade-offs in terms of government policy and the like. And of course, that led down some rough roads, to say the least. But what to me is similar is you have conversations now with people who are, again, either from a public health standpoint or an economic security standpoint, I think, saying loud and clear, I'll take the trade-offs. As I said earlier, I'll take the invasions or infringements on my privacy. And I wonder, Jennifer, you're in the other city that was hit so hard nearly 2 decades ago. Do you find a similarity in the conversation here? Is it informative or instructive at all to think in those ways?
So, I mean, clearly there's some similarities in that it was a massive shock and completely unexpected, and it took us all by surprise, and we felt a need, and we did take some extraordinary steps afterwards. I think on the surveillance side, there's something very different though. So when you're talking about the kind of surveillance systems that were put in place after 9/11, they were put in place to track terrorist suspects. And also to some extent to expand law enforcement authorities as well. And those kinds of surveillance systems, almost by definition, require a great deal of secrecy, at least secrecy in terms of their operation, because you don't want to tip off terrorism suspects or the target of a law enforcement investigation. I think there's something very different, and I think it's actually encouraging and positive and gives me hope that we can get this right with respect to health surveillance, is that the whole point of it is to be transparent. We want people to know what's happening. We want people to come and get tested. We want people to opt into the systems and learn the information that will help keep them safe. And so I think that provides an opening for a much more honest conversation, for much more accountability, and for hopefully doing the certain things right that we perhaps avoiding some of the excesses that we kind of fell into after the September 11th attacks. And then finally, I'm just going to reiterate a point that's been made repeatedly today, which is the importance of, to the extent that we're talking about any new extraordinary measures, I think one thing we've learned, not just from 9/11, but from emergencies historically, is the risks that what seems like an extraordinary measure becomes an ordinary measure.
Right.
So to reiterate the importance of sunsets, if we're talking about data, deletion data after it's no longer useful, is critical when you're taking steps in response to an emergency, as we are right now.
Quick last word from you, Nikhil. I saw you raising your hand.
Yeah, thanks, Tom. I just wanted to reiterate that we shouldn't take an all or nothing approach here. It can't be a binary that in an emergency situation, you have to give up all your privacy. There are different shades to it, and therefore we need to have proportionality tests. We need to have privacy impact assessments also taking place, so that if there is a violation of privacy that's taking place, there is a test that's done to understand what the implications are and whether we really need to do it or not, whether it helps or not. So yes, we're in exceptional situations, but that doesn't mean that there shouldn't be a necessity and a proportionality test in place for any violation that happens.
Well said. We have come to the witching hour. Before we leave, I want to say a special thank you to our audience who've been with us in great number for the last several weeks. As you may know, we're offering all this content and programming free of charge. So this is a moment where I want to say that if you're finding value in joining these events and the content, we ask that you support our work. Every bit helps. You can do that via the link that's in the program description for today's event, or just by visiting asiasociety.org. Jennifer Daskal, Nikhil Pahwa, great to have you with us. I learned a lot, which is, for me anyway, the metric of a good conversation. So I thank you both. Be safe. We're in this together. Have a great day.
Thank you.
Thanks, Tom.